so my name is America. I'm an MS3, and you guys all know me, but I don't think you've ever met my friend, Dr. Rowe, and I will let her introduce herself.
Hi everyone, I am Dr. Tisha Rowe, and I am a family medicine physician here in Houston, Texas.
I and all of my subscribers have a lot of questions, especially about what's it like to be a doctor, did you do to get there, where did you go to school? So can you tell us how you got to be a family medicine physician?
I've always wanted to be a doctor. I know some people came to that decision a little later on, so I knew going into college that this is what I wanted to do. I went to University of Miami, and then I decided after I really wanted to get away from Miami. Like, who does that, right? Who wants to get away from Miami? Well, I did.
Why was that?
Because it was so close to home, and I'd never been away from home, and I just felt like I wanted to be free. And my boyfriend moved to Philadelphia, so that may have influenced it a little bit. Okay. Applied to a bunch of schools in Philadelphia. I got interviews at Penn, Temple, and Thomas Jefferson, I think. And I went to the Temple interview and I loved it so much I turned down my other interviews. I decided I wanted to do family medicine because I couldn't decide on one thing. I loved everything. I could have just as easily done OB. I could have just as easily done emergency. So I said, well, what's a specialty where I get to do a little bit of everything? So within family medicine, I could deliver babies, I could do OB, I could do procedures, and still do chronic care. I didn't come to that conclusion until my last year in medical school. Prior to that, I thought I wanted to be an orthopedic surgeon.
Wow.
I passed out in the OR and that was that.
Like from being on your legs or from the blood? Or?
Well, at one point I was president of the Orthopedic Society, been in multiple surgeries, but it was something about the drill that really bothered me. And he took that drill out and went for that knee, and the next thing I knew, I woke up in a hospital bed. I was bored in the OR, to be quite honest. I'd much rather be out rounding on patients. So between those two things, I knew, okay, I need to figure out something else. When I applied to residency, I knew that I wanted to get an MBA. Coming here to Houston, I decided to go to Baylor, and that gave me the opportunity to do a family medicine residency and get an MBA, which my residency program paid for. Yeah.
Wow. Yeah. How would you describe your med school experience?
I would say that med school was challenging. Going from high school to college, I didn't feel was a big transition. University of Miami is it's an amazing school. It is challenging. There are plenty of people I know who did not make it through the pre-med program, but I wasn't challenged to the point where I ever thought I would fail. You know, it was like, this is hard, but I got this. When you get to med school, it was really like, okay, maybe I don't have this. You know, really a step up, like a big jump. But I also will say we had a lot of fun. You know, I met some of what are now my best friends. Even though we studied hard, we traveled together. I went to Spain, to Ecuador during med school, you know, going to New York for New Year's with one of my best friends. We made time for fun despite studying hard and being in med school.
But I do know that you have a son.
Yes.
And when did you have your son, and how did that go with your plans in your life at the time?
I'm so glad you asked that question. For one, my entire life, I've always been a planner. Most of the times, things went according to my plan. I said I was going to med school, I got in. I said I was coming to Baylor, I got in. I had my son in my final year of residency and my first year of business school. And I did it, and I got through it. The challenge of going to medical school is that you are delaying everything in life. You're delaying your income potential. You're delaying starting a family. So if things happen, like, don't sweat it. Don't like beat yourself up. I was so mad at myself. Like, how could you do this? How could you get pregnant? You're supposed to be responsible. And now my son's like the best blessing ever. Like, so I'm so happy that
he really is.
I didn't, thank you. I didn't take another route.
And doctor, I was wondering if you could shed any light for what it's like to be a woman in medicine.
Oh my gosh, it's like it mirrors every other industry. You would think that, oh, well, we're all intelligent and we're doctors, so people aren't going to be sexist.
Right.
Despite the challenges of being a woman in medicine, I've still managed to make it to the top. I still have been in multiple situations where I'm the head of the room and are working with me, but am I going to say it's always perfect and everyone always treats you equal? Absolutely not. Definitely the nurse thing is very common. I've had female patients tell me that they would prefer a male doctor. You have people call you cutie, sweetie, honey, which they don't mean anything by it, but you're like, I kind of went to school for 12 years. Maybe you can call me doctor. I think the one thing I would want to impart on you all is that medicine is changing and medicine is a business. And some people, especially older doctors, look at change as a burden, a problem. And I want you to look at the changes in medicine as exciting opportunities. You know, one of the things I said to you when I reached out to you, America, is like, I want more med students to know about telemedicine. So with telemedicine, it has afforded me so many opportunities. Like, I take my patients with me wherever I go. Like, I'm traveling, I'm on a plane literally every other week. And so I can see patients from my hotel room, I can see patients from anywhere. People will ask, well, how did you get into telemedicine? Why are you even doing this? And what really brought me to telemedicine was social media. I really thought, well, hey, if I can answer questions via Facebook Messenger or Instagram DM, how do I protect the patient, protect their privacy, and make sure that everyone still gets taken care of?
And HIPAA friendly.
And HIPAA friendly. You will always need an ER. You will always need an urgent care. You will always need to go in for your physical. But for routine things like, I just need a refill on my birth control, I need to get tested, I'm feeling kind of down. I'm here in Houston, which means I can see anyone anywhere in Texas, but we have doctors in 30 states. So my normal clinic hours will be 10 to 2. I do have Chase, as you know, 7-year-old. So I take my son to school in the morning. I have the flexibility in my schedule to say, this is the way that I want to practice. This is what makes me happy. So if I'm going to see patients, I'll see patients in the office from 10 to 2. Now, if I have a virtual appointment, I'll do it later in the afternoon. You do get to see a diversity of cases. I don't see peds. I don't see pediatrics or kids. They're their own little beings. They're not just small adults. Like, there's so many things that are unique to kids. I want a kid to get like the best care, someone that sees peds all day, every day, not me seeing pediatrics here and there.
Would you choose family medicine all over again?
I absolutely would. Now that I'm actually doing it, I get to see how broad the specialty is. You can work as a hospitalist on 1 week. The next week you could be doing urgent care. I know family medicine doctors that focus on aesthetics, who only do weight loss, who do skincare, things that have to do with derm. If at any point in your career you get bored, you don't need a new residency to be able to create a niche within medicine for yourself. You're trained and prepared for behavioral health, for women's health, adult medicine, and children. We didn't tell them how we met.
Oh, me and we met through my mom, right?
Yes, and you shadowed me. You were one of the first people who ever shadowed me in my first clinic. And so that's why it's so like exciting to me to see how you've grown, how you've flourished, and being on this med student journey. And I cannot wait till the day I can say like, this is my colleague, and refer patients to you. Truly, I brag on you all the time.
All right, everybody. Well, thank you so much for watching this video. I hope that you enjoyed it and that it was a very informative. I would like to thank my guest, Dr. Rowe, for being here and taking the time out of her day to teach the world about family medicine and telemedicine.
And thank you for having me, America.
No problem. And like always, guys, I will see you in my next video. Goodbye, everyone.
Bye.
If you love Dr. Rowe and want to know more about her, follow her on her social media. And if you are a health practitioner in the state of Texas and would love to be interviewed and featured on my channel, please send me a message in my email found in the info box below. Other than that, I have one final question for all of you.